So I practice something called acceptance and commitment therapy. And just like the name says, there is a lot of acceptance work around it. And that word can sometimes get people. It often feels like it means we just have to tolerate what's happening and, just kind of suck it up and deal with it. That's not what we're talking about here. Acceptance is really just feeling what's happening in the present moment without judgment and not trying so hard to fight what's happening. So we can work to make change in the future, but we don't want to fight it so hard that it causes all this extra stress in our body in the present moment, which actually makes it harder to make changes later on. Acceptance work often, it might sound a little counterintuitive, but we actually learn to accept really difficult thoughts and feelings and bodily sensations. Once you allow it to be there, ironically, that's when the change can start to happen. So it's a bit of a process in learning how to do that, but acceptance and commitment therapy does help teach you how to do that. The whole goal is to help you to start behaving in ways that make you feel empowered and make you feel alive and make you feel like your life has meaning and purpose. We're not telling you to accept the pain. We're just trying to get rid of the I'll be happy when, because if we constantly live in the I'll be happy when, the when never comes. A lot of times what gets in the way of acceptance is when we start to find ourselves in really rigid right and wrong thinking. This is the right way to eat. This is the wrong way to think. This is the right way to move my body. This is the wrong way to move my body. Most things have a lot of nuance to them, and there isn't a whole lot of absolute rights and wrongs when you're managing a chronic illness. So avoiding your emotions and sensations, that's also something that can get in the way of acceptance work, cultural pressure, feeling misunderstood, lack of accommodations. This is a big one. It's not all on you. Sometimes our world is really just not set up to accommodate us in the way that we need. The part that's our responsibility is recognizing that, taking the blame away from ourselves, and then asking for what we need. And again, you might not always get what you're asking for, but it's still important that we're learning how to do that so that we can figure out what accommodations we can get. In acceptance work, we do a lot of clarity around values. So really figuring out what's important to you, properly grieving, really giving time and space to the grief and the feelings that come up, learning how to handle distress. There are skills we can learn to tolerate distress. And again, that doesn't mean that you just learn to be okay with it. It means distress is a part of life. It happens, and we have to learn how to build our resources so that we can handle it and move through it and get to the other side of it.